tonight. The subject matter is one of my favorite three subjects, which is gut health. And I'd like to thank you, Christine. Christine sent me some questions and wanted to have me answer them. And I chose this modality here on video for Instagram and Facebook. So we're just going to go through some questions. So let's go. The first question: what is gut health and who does it affect? All age groups? Well, I'd say yes, it does affect all age groups. And the big thing I'm finding is it doesn't matter how old you are. I've had 90-year-old patients question me on this. And the reality is if you change your diet at whatever age you are, you can get health benefits. So what is it? Well, it all boils down to a healthy microbiome. That's your gut bacteria and other microorganisms in the gut. Now remember, you have got 10 times as many bugs in your gut than you have cells in your body. 10 times. And as I joke with patients, and I say this, you think that you're living yourself or living your life as yourself when you're actually not even that. You are 1/10 of the cells in your body because the bugs have got 9/10 of them. 300 trillion of them approximately, and 30 trillion of us. So we're outnumbered. So the whole point here is to eat foods that allow those bugs to flourish. We'll call them the good bugs, can flourish and therefore give you optimal health. So that's what it's really about at the end of the day. So what are the symptoms you can have if you've got poor gut health? Well, the medical term is called leaky bowel syndrome. Now this is kind of quasi-medical diagnosis. You're not going to get this from your regular specialist who deals with gut health. Because I was looking up WebMD, I was looking up the Mayo Clinic to see what they were saying on this subject. And it's kind of a controversial subject. Well, I think it depends on your mindset, and I think it depends on your openness to the facts and the studies that have been done around the subject and the health benefits. At the end of the day, it's about health benefits to patients who change their diet, change the foods, and therefore reduce inflammation and therefore improve the leaky gut. And what that means is in the intestine, you have 1 cell thick of lining around the intestine. It's a little bit like shaped like the Himalayas. It goes up and down, up and down, up and down, up and down. And that's if you take a microscope and look at your intestine, small intestine. And then if you take a bigger look at the microscope, there's even smaller mountains called villi in the small intestine. And each of these villi are lined by single cell endothelial linings, which just means an entry point from the gut into the body. And these linings are interrupted. Little holes, a gap, appear when you have a leaky bowel or inflammatory conditions within the bowel because of foods. So, what's happening here is you can get symptoms. Now, the symptoms that I'm seeing in patients and also that I've read about are bloating, probably the number one, gas, or maybe diarrhea, constipation. Irritable bowel is a good one. Immune deficiencies, a lot of people have got immune deficiencies, that can be a cause. Nutritional deficiencies, you're not absorbing the nutrients, maybe the iron, maybe the B12 and others. Headaches, brain fog, lack of memory. This is one of the classic ones that improves as you go forward with this situation and treat it with diet. Fatigue, excessive fatigue. If that's you, I would be talking to your practitioner, maybe a naturopathic doctor about this to see if that can be helped. Skin rashes, eczema, psoriasis, all very common. Inflammatory diseases or inflammatory skin rashes caused by inflammation in the gut first. You get cravings for carbs or sugars, another. And the last one, generalized aches and pains. So these are some of the symptoms. So how do you treat gut health? Well, you treat it by eating a diet that has low or no, so probably in realism or realistic terms, low inflammatory foods. And one question was, what are your success stories? Well, I looked over my audit. I've been checking out all my patients. I covered 30 patients in the last 6 months or so, maybe a little bit longer. And I looked at the data on it. On average, there was 9 pounds loss in weight. 9 pounds lost, average, over 30 people. So some people were 44 pounds because they've been doing it for maybe 7 months. There's other people, maybe a few pounds because they've been doing it for a week or so. So a lot of people find weight reductions, and that's looking at everybody who had noted to me a weight reduction. So that's what's an average. And the average time there was about 14 weeks. So give or take, £1 a week. And some individual cases come to mind. A 20-year-old student who lost 40 pounds, severe headaches, unrelenting headaches. Headaches are improved with my other technique called trigger point injections, but she's dropped 40 pounds and her headaches are better. Another lady I remember very clearly, 59 years old, several weeks on the diet, burning, incapacitating leg pain, gone. Because of that, purely because of that. Her life is transformed, and she also lost a lot of weight. It was 28 pounds. So these are some of the testimonials and some of the averages that I'm finding in my patients. So what are some healthy food choices? Is gluten-free good for us? And what is a lectin? Well, let's go to the last point first. Lectins, they are inflammatory proteins, been around for 100 years. They are the reason we know you've got a blood group of A, B, AB, or O. So they've been around for a long time. But the science has just, in the last decade, come forward showing that foods with gluten and milk are the big two. Gluten and milk, or bread and milk, are the big two that contain inflammatory proteins. So if you stop those, one of my colleagues, Rob Silverman, said to me in a podcast show, 90% of people can get rid of their inflammation and problems if they avoid this food group. Another question is healthy plate. What does a healthy plate look like? Well, that would be salad, olive oil, extra virgin olive oil with vinegar, any type, with a splash of lemon on there to give it good flavor. Maybe you could sprinkle some lovely cheese from Italy, Parmesan from Italy. And if you choose any cheeses with this salad, you could have Brie from France or some Swiss cheese. And all those cheeses are from Southern Europe. And it's important to take them from Southern Europe because the milk products there have got casein A2 protein, which is absent of lectins, unlike Northern Europe and also Northern America. So milk products, cheeses, for example, North America and North Europe, not good for lectins. So that would be a great food on a plate. If you want some meat, you could put some meat on there or have a separate dish, and it would be grass-fed or wild animal like bison or pork, grass-fed pork if that's possible, grass-fed chicken if you're living in a place where that's possible, wild fish, salmon for example, or omega-3 eggs are the best of the eggs. So these are a balanced diet for meat, small amount, maybe the size of your palm is fine, with lots of veggies, olive oil for your fat, vinegar, and your lemon. And those three things are polyphenols or antioxidants, which are great for healing the leaky gut. So some resources, maybe you want to read up more on this. The Plant Paradox by Stephen Gundry, and also Grain Brain by David Perlmutter. So David is a gastroenterologist from the East Coast of the US, and Dr. Gundry is a cardiologist and cardiothoracic surgeon from the West Coast of America in Palm Springs. So great books, lots of information, lots of science explaining this. And those two physicians are pioneers and leaders in the world on this subject. And the last question, is bread bad for you? What about sourdough and why? Well, bread contains grains, and grains that are also in rye, oats, barley, and also, it's not a grain, but also rice contain lectins. And if you eat these grains, it can cause inflammation in your gut, which is not the best. So my recommendation for patients who really must have some bread today, like, Dr. Wayne, I must have some bread, eat sourdough. Why? Because it's fermented. The best ones are fermented. And when you ferment the protein of lectin, you destroy it or you reduce the load, and it's not as lectin or inflammatory loading for your colon and your small intestine, and therefore your health. So, hope you liked that. It's a bit of a longer video than normal. It was really good to talk about it. Thank you, Christine, once again. We'll get that transcript off to you because that's what you want. And again, give me a request, send an email. I look forward to it. And I really thank you for hanging out with me today. All the best and have a happy gut.